there are currently 7.6 million people who are waiting for some form of NHS procedure. Now, the Labour Party, perfectly cleverly, putting in freedom of information requests, have released today that 121,000 people have died whilst they were on the NHS waiting lists and not treated within the specified time of 18 weeks. Politically, very clever. Let's listen to senior Labour politician Emily Thornberry.
The NHS Constitution says that you have a right to see a doctor within 18 weeks, and that isn't happening. And people are dying in pain and fear, hoping that there's going to be help coming, and that help doesn't come. Now, the NHS was not behaving like this when there was a Labour government. I'm sorry to say this, but it is the truth. Over the last 13 years, we have seen the way in which the NHS has been diminished under this Conservative government, and they have no plan for doing anything about it.
Well, forgive me for having a touch of déjà vu, but it begins to feel a bit like 1997. Yes, of course, the Tories have been in for 18 years. Yes, of course, there was back to basics and all the sleaze. But actually, I think the biggest factor that got Blair that massive majority back in 97 was that people trusted Labour far more to run the NHS than they did the Conservative Party. And that's the game that Labour are playing right now. Are they sincere in what they say? Is it fair to put this death toll on waiting times, on the Conservative Party? But above all, would Labour do better? Please give me your thoughts. Farage@gbnews.com. Now, I'm joined by Roy Lilley, former NHS Trust Chairman. Roy, there is no doubt that these continual increases in NHS waiting times for procedures, some very small, some very big, it's a major source of public concern, isn't it?
Oh, it is. There's no question about it. And it's why the Prime Minister's made it one of his 5 priorities. And good luck with that, because every time he gets... I mean, if we think about it, recently, the NHS, there was a kind of window at the beginning of this year where the NHS got stuck in and they reduced the 2-year waits to almost nothing. So they can churn it out if they're given a chance. But of course, the problem we've got now are the strikes, and we've heard more strikes are going to be coordinated.
Well, I was keen to get that because, I mean, BMA talking this afternoon, for the first time ever in the history of the NHS, it'll be the junior doctors and consultants going on strikes to slow down. What do you make of that?
Well, I don't want to downplay it. Don't misunderstand what I'm going to say. But the NHS is now pretty good at handling these strikes. So what will happen, I think, is, well, I'm assuming the BMA will allow this kind of Christmas Day type cover for the blue light for the front door, for ITU, and some derogations allowing docs to come in under specific circumstances. So, I mean, it will, there's no question about it, the whole of the back end of the NHS will come to a grinding halt. And that's where the implication is for waiting lists. Now, of course, we think people are waiting, well, they'll be all right, they'll wait a bit longer. Actually, that isn't true. I mean, we've seen the numbers that Labour have dug up today. Yeah. We really do have to look a bit closer to them. It was 25% of the Trust replied. They extrapolated the rest of the numbers, which is fair enough. Yeah. But, of course, if you're on the waiting list for a bunion and you die because you're 96, you haven't died of your bunion. So I
was struck by that. There was another figure that was released today that 340,000 of people who died in Britain last year, and that's 60% of those who died, had a medical condition. Well, I mean, that's hardly surprising, is it?
You could say, a man with a red tie died today, he had a medical condition. We've all got... So I think we've got to be careful.
So our Labour, I mean, getting back to Emily Thornberry, and Wes Streeting was out there, but Emily Thornberry was the most senior Labour politician out there today. And you can see the political angle that she's taking. As I say, it is a repeat of the 97 election.
I go back to when Robin Cook was Labour's Shadow Secretary of State. And at the time, I was the vice chairman of the Confed, which is like the trade organisation for the hospitals. And there was an election coming, and, we wanted to kind of be fair and brief everybody. And I remember going to see him in his chaotic office in Westminster and say, would you like a briefing from the Confed? And he said, no, thanks. We're just going to let the Tories make a mess of it and pick holes in what they're doing. And that's sort of
Is that really what he said?
Yeah. Oh, yeah.
Well, I mean, in terms of cynicism, it rates at about 100%. But in terms of political practicality...
Well, I mean, you're a politician. You know exactly. I mean, let's not pretend you don't know what's going on here. Look, the nub of this is... Labour are not going to be able to do anything about it either. The situation is this.
So are you suggesting it would not be better under Labour?
I think it will be... Well, I think the instinct might be to put more money in, and I think the instinct would be to have a bit of a reorganisation, which is always a bad thing. I mean, we don't need more reorganisations, but we're likely to get one. And they've got this idea that they're going to fund more doctors and nurses by taxing non-doms. Well, any non-doms that's got half their wits about them will be long gone before there's a Labour government. So I don't think that's going to work very well. But look, what's happened here, Nigel, is that it goes back a long way. Following the world banking crisis, we had 10 years of pretty much flatline funding. Under 2% for the NHS for 8 years.
Under 2% rises?
Yes, under 2% increases every year.
Yeah.
It needs 4% just to keep its head above water. We didn't recruit enough nurses, recruit enough doctors, buy enough kit, innovate enough, repair enough, build enough, whatever. And so we came into COVID then. And at that time, waiting lists were at 4.5 million. And we had 40,000 vacancies in nurses. We all forget that. Then along came COVID, all bets are off, the government chucks money everywhere, spaffs most of it, everybody somehow or other muddles through, and now we come out the other side with people who didn't go to the NHS during COVID for all sorts of reasons. We got 7.5 million now, I think it's closer to 8. And of course the other thing is this, the strikes have knocked nearly 900,000 people off the waiting list. So they've come off because they've missed their turn because the NHS has been on strike, and they've got to go back. Now, the chaos that causes is almost indescribable for hospitals because it's a huge manual thing. Somehow or other...
Right, how can it be right? I mean, I get junior doctors work long hours, and it's a very long apprenticeship in many cases, and they're not very highly paid, although when they get to the end of it, they are. These consultants that are going to go on short hours, semi-strikes, however you... I mean, half of them are working in Harley Street in their free time. How can we have any sympathy with them at all?
I think they've failed to read the room.
OK, good. Really? Please, I haven't missed this one then. Yeah.
No, I think they've messed it up. And to be honest, I don't have any sympathy. I mean, I've sort of got the nurses' strike. I sort of got the junior doctor strike.
Although not 35%.
No. But I think, to be honest, that was mismanaged comms because what they were doing, they were saying the value of our wage packet has gone down by 35% because of inflation and the traction has been lost. Yeah. So, I mean, they're not stupid. The ones that I've spoken to, they realise they're not going to get 35%. What they'll do is they'll get a deal over 3 years and they'll push the big chunk of money for the third year into Labour when there's a Labour government, if you want to talk about cynical politics, but that's what's going to happen. But, I mean, I can't look a consultant in the eye that's, even if they're not doing private work, they're between 80 to 100 grand a year. They're highly educated people in doing the jobs they love and want. How they can turn their backs on people in this way and say, oh, it's the government that's made me do it. It's not. The only person that makes them do it is the person that looks at them in the mirror when they clean their teeth in the morning. They make those decisions.
I think they're going to be around popular. So, Roy, we know long waiting lists. There are some people that would die that ought to get treatment. But Labour are over-egging this, aren't they?
I think, well, they certainly, from what Emily Thornberry said today, I think that's misleading, actually, what she said, by associating deaths with waiting. There was no correlation in that data. I'm not saying that there isn't a correlation, and I'm not saying that delayed care is dangerous care and people will die waiting, but these numbers are entirely spurious. But as far as Labour is concerned, I mean, they don't have a plan, do they? They don't say, OK, on day one, we're going to do this, and this, going to sort out that and that. And the reason is, Nigel, they can't do that because all of the problems the NHS have got are very long range. Now, if you look at the workforce plan, actually, which was published a couple of months ago, it's a 15-year recovery programme.
Wow. Because
it takes so long to train a doctor and train a nurse.
Which is 3 parliaments.
Exactly. And do you think it's really going to be, if we talk about cynical politics, is it going to be funded in the second and third parliament? I don't think so. We'll have a new workforce plan by then.
Roy Lilley, with all your deep experience and passion for this subject, it is, I have to say, a little bit disappointing to hear your pessimism about the future.
Well, listen. You know, I'm the flag waver for the NHS. We've known each other for a long time. I've been true and faithful to it, and I do believe in socialised medicine, and I do think it's a great system. But I am truly worried for the future. I think, a lot of staff are very hacked off, and once you lose morale, you start to lose, you take your eye off the ball. I think the recovery program is going to be a long time. I do think if we can get a clear period of sensible funding, and I'm not talking about, double the funding and what have you, 4.5%, something like that per annum. If we can get a clear run and the politicians sort these blooming strikes out, then I think we'll see a much quicker recovery than we all expect.
Well, provided we spend the money wisely, I guess that's the one proviso I would have on this.
Well, it's fair enough. I mean, it's a huge financial commitment, and I'm not saying, there's never waste, there's waste everywhere. But, I mean, broadly speaking, we get a pretty good bang for our bucks, I think, with the NHS.
Okay.
And a lot of people talk about private medicine, but you can take your insurance policy subscriptions out of your left-hand pocket, and you can take your taxes out of your right-hand pocket. It's still your trousers. You're still going to pay.
We've still got to pay. Roy Lilley, as ever, superb.